Hello. Welcome to Dr. Updated. Diagnostic techniques are fundamental for general practitioners in providing accurate diagnoses, guiding treatment decisions, monitoring disease progression, and promoting preventive care, ultimately contributing to better patient outcomes and quality of life. If you're not yet subscribed to our channel, kindly subscribe. Taking a good patient history is fundamental to making accurate diagnoses and providing optimal care. Here's a structured approach to taking a comprehensive patient history. 1. Introduction and establishing rapport. Greet the patient warmly and introduce yourself. Establish a comfortable environment to encourage open communication. Use open-ended questions to allow the patient to share their concerns and perspective. 2. Chief complaint. Begin by asking the patient about their main reason for seeking medical attention. Use open-ended questions to elicit detailed information about the nature, duration, severity, and progression of the symptoms. 3. History of present illness, HPI. Explore the onset of symptoms, including any precipitating factors or events. Inquire about associated symptoms, aggravating and alleviating factors, and any treatments or interventions tried by the patient. 4. Past medical history, PMH. Ask about past medical conditions, surgeries, hospitalizations, and significant illnesses. Inquire about chronic medical conditions, allergies, and adverse reactions to medications. 5. Medication history. Obtain a list of current medications, including prescription drugs, over-the-counter medications, supplements, and herbal remedies. Ask about the dosage, frequency, and duration of medication use. 6. Family history. Inquire about the health status of immediate family members, including parents, siblings, and children. Pay attention to any family history of hereditary conditions, chronic diseases, or significant medical events. 7. Social history. Ask about the patient's occupation, living situation, and lifestyle habits, for example, smoking, alcohol consumption, exercise routine. Inquire about dietary habits, substance use, sexual history, and any relevant environmental exposures. 8. Review of systems, ROS. Systematically inquire about symptoms related to each major organ system, including cardiovascular, respiratory, gastrointestinal, genitourinary, musculoskeletal, neurological, dermatological, and psychiatric systems. Pay attention to any additional symptoms or issues reported by the patient. 9. Closing and summary. Summarize the key points discussed during the history-taking process. Offer the patient an opportunity to ask questions or provide additional information. Express appreciation for the patient's cooperation and participation in the history-taking process. Throughout the history-taking process, maintain a non-judgmental and empathetic attitude, and actively listen to the patient's concerns. Use language that is easily understandable and avoid medical jargon whenever possible. Finally, document the patient history accurately and comprehensively in the medical record for future reference. As a general practitioner, conducting a thorough physical examination is essential for assessing a patient's health status and identifying potential issues. Here are some common techniques used in physical examination. 1. General inspection. Observe the patient's overall appearance, demeanor, and level of distress. Note any signs of distress, discomfort, or abnormal behavior. 2. Vital signs. Measure vital signs including temperature, pulse, palpate the radial pulse for rate, rhythm, and character. Blood pressure. Respiratory rate, count the number of breaths per minute. Oxygen saturation, use a pulse oximeter to measure oxygen saturation levels. 3. Head and neck examination. Inspect the head and scalp for lesions, scars, or abnormalities. Palpate the skull for tenderness or deformities. Assess the eyes, ears, nose, and throat for any abnormalities. 4. Cardiovascular examination. Auscultate the heart sounds using a stethoscope to assess for murmurs, gallops, or irregular rhythms. Palpate peripheral pulses, including radial, brachial, and dorsalis pedis pulses. Assess for signs of peripheral edema and jugular venous distension. 5. Respiratory examination. Auscultate lung fields anteriorly and posteriorly for breath sounds, including crackles, wheezes, and diminished breath sounds. Percusses lung fields to assess for dullness or hyperresonance. Assess respiratory effort and chest expansion. 6. Abdominal examination. Inspect the abdomen for symmetry, distension, scars, or visible pulsations. Auscultate bowel sounds in all quadrants. Palpate the abdomen systematically for tenderness, masses, organ enlargement, or rebound tenderness. Perform liver and spleen palpation and assess for organomegaly. 7. Musculoskeletal examination. Inspect the musculoskeletal system for deformities, asymmetry, or abnormalities in posture and gait. Palpate joints for tenderness, swelling, warmth, and range of motion. Perform muscle strength testing and assess for signs of inflammation or joint instability. 8. Neurological examination. Assess mental status, orientation, and cognitive function. Evaluate cranial nerves, including visual acuity, pupillary response, and facial sensation. Test motor strength, coordination, reflexes, and sensation in all extremities. Assess gait and balance. 9. Skin examination. Inspect the skin for lesions, rashes, ulcers, moles, or signs of trauma. Palpate skin lesions for texture, temperature, and tenderness. Assess skin turgor and hydration status. 10. Genitourinary examination. Perform genital examination as indicated based on the patient's presenting complaint or medical history. Palpate the abdomen for bladder distension or tenderness. Assess for signs of urinary retention or incontinence. It's important for general practitioner to conduct physical examinations systematically and document their findings accurately to inform diagnosis and treatment decisions. Additionally, should consider patient comfort and privacy throughout the examination process. Diagnostic tests. General practitioners commonly order a variety of diagnostic tests to aid in the diagnosis and management of various medical conditions. Here are some common diagnostic tests ordered by GPs. 1. Blood tests. Complete blood count, CBC evaluates red blood cells, white blood cells, and platelets, helping to diagnose anemia, infection, and other blood disorders. Basic Metabolic Panel, BMP, a comprehensive metabolic panel, CMP measures electrolytes, glucose, kidney function, and liver enzymes. Lipid Profile, assesses cholesterol levels and lipid fractions to evaluate cardiovascular risk. Thyroid Function Tests. Measures thyroid hormone levels, TSH, T3, T4, to assess thyroid function. 2. Urinalysis. Evaluates the physical, chemical, and microscopic properties of urine to detect urinary tract infections, kidney disorders, and metabolic abnormalities. 3. Imaging studies. X-rays. Used to visualize bones and detect fractures, joint abnormalities, and pulmonary conditions. Ultrasound. Non-invasive imaging technique used to evaluate internal organs, blood vessels, and soft tissues. Computed tomography, CT scan. Provides detailed cross-sectional images of internal structures for diagnosing conditions such as tumors, infections, and injuries. Magnetic resonance imaging, MRI. Produces detailed images of soft tissues, organs, and musculoskeletal structures, helping to diagnose conditions such as brain disorders, spinal cord injuries, and joint injuries. 4. Electrocardiogram, ECG or EKG. Records the electrical activity of the heart to evaluate heart rhythm and detect abnormalities such as arrhythmias, myocardial infarction, and conduction disorders. 5. Pulmonary function tests, PFT. Measures lung function and capacity to diagnose respiratory conditions such as asthma, chronic obstructive pulmonary disease, COPD, and restrictive lung diseases. 6. Stool tests. Fecal occult blood test, FOBT. Screens for blood in the stool, which may indicate gastrointestinal bleeding or colorectal cancer. Stool culture. Identifies bacteria, viruses, and parasites in the stool to diagnose gastrointestinal infections. 7. Electrolyte and blood gas analysis. Arterial blood gas, ABG. Measures pH, oxygen, carbon dioxide, and bicarbonate levels in arterial blood to assess respiratory and metabolic function. 8. Allergy testing. Includes skin prick tests or blood tests to identify allergens responsible for allergic reactions. 9. Microbiological tests. Includes cultures and sensitivity testing to identify pathogens and determine the most effective antibiotics for treating infections. 10. Screening tests. Depending on age, sex, and risk factors, GPs may order screening tests such as mammograms, Pap smears, prostate-specific antigen, PSA tests, and colonoscopies to detect cancer and other diseases at early stages. These are just a few examples of the many diagnostic tests that GPs may order to assist in the diagnosis, monitoring, and management of their patients' health conditions. The choice of tests depends on the patient's clinical presentation, medical history, and suspected diagnosis. Clinical reasoning. Clinical reasoning is a critical cognitive process that allows general practitioners to analyze patient information, make accurate diagnoses, and develop appropriate management plans. Here are some key components of common clinical reasoning by GPs. 1. Data collection. General practitioner gather patient data through history taking, physical examination, and diagnostic tests. They systematically collect relevant information related to the patient's symptoms, medical history, medications, allergies, social history, and family history. Data collection involves listening to the patient, asking relevant questions, and synthesizing information from multiple sources. 2. Pattern recognition. GP use pattern recognition to identify common clinical presentations and typical symptom clusters associated with specific diseases. They draw upon their clinical experience and knowledge base to recognize patterns of signs and symptoms that suggest particular diagnoses. 3. Hypothesis generation. Based on the collected data and pattern recognition, GPs generate a list of differential diagnoses. They consider various possible explanations for the patient's symptoms and prioritize the most likely diagnosis based on clinical findings and context. 4. Diagnostic testing and confirmation. GPs order diagnostic tests to confirm or refute their diagnostic hypotheses. They select appropriate tests based on the differential diagnosis, clinical guidelines, and patient preferences. Diagnostic testing helps to gather objective data and further refine the diagnostic process. 5. Clinical judgment and decision-making. GPs integrate clinical data, diagnostic test results, and their own judgment to arrive at a final diagnosis. They weigh the probability of different diagnoses, considering the likelihood of various disease processes in the context of the patient's presentation and risk factors. Clinical judgment involves balancing diagnostic certainty, patient safety, and the potential benefits and risks of treatment options. 6. Treatment planning and management. Once a diagnosis is established, GP develop a treatment plan tailored to the patient's individual needs, preferences, and circumstances. They consider evidence-based treatment guidelines, therapeutic options, and patient-specific factors such as comorbidities and medication tolerability. Treatment planning also involves setting realistic goals, educating patients about their condition, and coordinating care with other healthcare providers when necessary. 7. Monitoring and follow-up. GPs monitor patient progress and response to treatment through regular follow-up appointments and ongoing assessment. They adjust treatment plans as needed based on changes in the patient's clinical status, treatment efficacy, and potential adverse effects. Monitoring and follow-up ensure continuity of care and help optimize patient outcomes over time. Overall, clinical reasoning is a dynamic and iterative process that requires critical thinking, problem-solving skills, and collaboration with patients and other healthcare professionals. GP continually refine their clinical reasoning abilities through experience, reflection, and ongoing professional development. Communication skills for general practitioners. Effective communication is essential for general practitioners to build trust, establish rapport, and facilitate positive patient outcomes. Here are some common communication skills that general practitioner should cultivate. Active listening. Empathy and compassion. Clear and concise communication. Open-ended questions. Nonverbal communication. Cultural competence. Shared decision-making. Providing feedback and reassurance. Conflict resolution and de-escalation. By honing these communication skills, GPs can enhance patient satisfaction, improve treatment adherence, and foster positive health outcomes for their patients. By adopting these techniques, general practitioner may have greater success and patient satisfaction. Kindly subscribe and like video to encourage to bring you more useful videos. Thank you so much.